the reflections, the commitment, the advocacy to bring hope alive in the health sector. Well, we're lucky today that we have those ministries that are very germane to ensuring the success of why we're gathered here and moving the health sector forward. Our next speaker represents that very strong pillar. Please welcome with me His Excellency, the former governor of Kebbi State and the Minister of National Planning and Budget, Senator Bagudu. I want the applause to be very, very loud.
Thank you. Thank you. Thank you very much, Moji. Thank you. And the two coordinating ministers, my brothers, Olawale Edun. I don't know whether he's of Lagos or of Ogun or Asolakose or of Nigeria, obviously. And my brother, Professor Alipati, as well as the Honorable Minister of State, Dr. Isai Salako, and all my sisters, aides of Mr. President that are here, World Bank Country Director, Development Partners, represent traditional institutions, commissioners, and representative of local governments. Good afternoon, everyone. Let me start by congratulating the Minister, the Coordinating Minister of Health, and his team for this wonderful innovation, because this joint annual review is unique in the sense that it reflects what our Constitution anticipates should happen, especially in health, because health is a responsibility of the three tiers of government in Nigeria: local government, state, and as well as federal government. So how better than to have a compact which generate an irreducible minimum of commitments by those three tiers of government. Our constitutional federalism is cooperative. The three tiers of government are expected to work together, and that is why this is a laudable innovation and is consistent with the abode belief in the federalism by our President Bola Ahmed Tinubu, because he's one of Nigeria's most ardent believers in true federalism. In fact, he has taken true federalism further by saying that the ultimate true federalism is to ensure that the lowest level of governance is recognized, supported, so that opportunities unique to that level of governance are identified, and the three tiers of government coming together to support that identification. Ward development plan. And Professor Alipate, long ago, as Chief Executive of the Primary Healthcare Development Agency, also recognized this importance of our Constitution and the ward, in the sense that what he proposed then, as was adopted, was that each primary health care should have a ward development committee, because that's the ultimate, so that we can generate understanding of demand from those levels too. And so what is being done today is a celebration. And the coordinating minister of the economy, who maybe did not receive as much ovation, because when Salma spoke about more revenue, maybe they didn't recognize that what has been achieved in the last 2 years is just miracle. because the renewed hope agenda of Mr. President is recognizing that we have underinvested in almost every sector of our national life, simply because we do not have the resources to do so. And without blame game, he said, how can we fix that? How can we distortions that saw us throwing away money? And we undertook the macroeconomic reforms that today have helped with revenue to the three tiers of government. The coordinating minister of the economy and I were at a function, I think about a month ago, when the Nasarawa state governor said in his first term in office, which is between 2019 to 2023, the highest monthly pack distribution was under 580 billion naira. But for many months this year, it is over 2 trillion. So this is the clearest evidence that the strategy is working. And one of the things that maybe should be a takeaway here is that all of us should articulate what can we do to put pressure on the three tiers of government, particularly local government and states, so that they can put more of those resources they are earning into those sectors, including health, that we believe can do with more investment. We are not where we want to be. The best measure around the world is revenue to GDP ratio. I'm sure Matthew of World Bank can say it better than I. The global average, or maybe the European average, I think is about 29% revenue to GDP. When we came, President Bola Ahmed Tinubu inherited less than 8%. He has tasked us, rather to the coordinating minister of the economy, to lead us to at least 18% by end of 2026. So that means we are going to have more revenue for the health sector. And with all the tax reforms, among others, with all the tax reforms in place, digitization and efficiencies that we are building, we are certain to achieve that. Not only that, Mr. President have unfolded a vision that we should aim to quadruple the size of our economy in the next 5 years. A Herculean challenge that we should aim for a $1 trillion economy, and that means we want a healthy population to support that drive. We want more investment. And we are seeing all of that in all sectors, part of it because of the efforts of the two coordinating ministers, which is unique to our government. Because just last week, we signed a number of financing agreement, EU health investment for Nigeria, which is remarkable, and we are seeing it by the day. So even with the challenges that multilateralism is facing, we are seeing a line of sight to a Nigeria of our dream under the able leadership of President Bola Ahmed Tinubu. And we believe more resources will come into the health sector, but it's not just resources that are required. There is also need to ensure that those resources lead to better outcomes. And that is why the decentralization of the challenge by focusing on primary health care at the ward level is almost an absolute irreducible minimum. And we are glad that this review and the compact is focusing on that. Last but not the least, just last week, Mr. President, about 2 weeks ago, His Excellency Mr. President attended the National Economic Council meeting, where he appreciated what has been achieved, but he told governors, because Mr. President respects our federalism very much, he told governors that, yes, we have achieved this, but what the world wants to hear is that we are staying the course of those reforms. And I'm sure when the coordinating minister comes, we will hear more of that, because it is those resources, those reforms that will continue to crowd in more governmental revenue. But equally, in addition to that, Mr. President demanded of the governors that they must collaborate together with the local government so that more outcomes can be achieved by identifying all the wards and their challenges and their opportunities, including in health and in education, in economic opportunities, so that we can bring the combined effect of the three tiers of government, development partners, and in fact, whole of society approach, so that each ward can be supported to do better in many outcomes. And luckily, in doing that, we have the support of the World Bank, because as my two baggies of the World Bank say, we already have a $500 million health governance program, which is supporting effective outcomes, as well as a $500 million health, $500 million of education. So I will end by congratulating Professor Pate and his team, and indeed congratulating our country, because Mr. President was very ingenious in ensuring that he found the best men for the job. The coordinating minister of health, the coordinating minister of the economy, who by all imagination are doing a great job, and we can be sure that more resources will be generated in the coming years to fund health, to fund our economic aspirations, to fund the 2026 to 2030 development plan, which we are developing now. And last is to tell all local governments and states, please, we are sending a mapping questionnaire, because we want to map the 8,809 wards in terms of what is in there. That mapping will be aggregated at the local government level to form a local government plan, which will also be aggregated at state levels to form the state plans, as well as collated at the national to form the national plan, which will support local governments and work together, and in tandem with our federalism, work together to ensure that it is delivered. Thank you very much.
Wow, that says it all. Giving us an insight into governance, into national development, into what is happening and which we can see. I pray that as we grow into it, we would advance into equity, into health that will meet the needs and aspirations of Nigerians. Our next speaker, I think, has been introduced. The minister introduced him so well. I can only add that I am proud of you, sir. Please welcome with me the Minister of Finance and Coordinating Minister of the Economy, Mr. Olawale Edun.
Thank you very much, and good afternoon. Thank you, Auntie Muji. The health is wealth. That is our well-known mantra and the belief of His Excellency President Bola Ahmed Tinubu, GCFR. My colleagues on the Federal Executive Council, Honorable Minister of Health and Coordinating Minister of Social Welfare, the Honorable Minister of Budget and Economic Planning, Honorable Minister of State for Health, the SSA to Mr. President on Health, our National Assembly members, I'll come back to you, the traditional rulers here present, And indeed, the development partners, the local governments, state commissioners, the whole of society, as His Excellency Senator Bagudu had said, the whole of society that is here that has risen for the health sector. You know, having been given the privilege of appointment by His Excellency President Bola Ahmed Tinubu, it's not a question of serving Lagos. Yes, I serve Lagos. Serving Ogun, I serve Ogun. The Southwest, I serve the Southwest. My mandate is to serve all Nigerians. Thank you. Distinguished participants, this is a very important gathering. It's a gathering that, as I said before, the whole of society is risen for, in this case, this joint annual review. And let me join others, so many others, starting from the representative of the Sultan of Sokoto, in commending not just our indefatigable, highly capable, energetic, and world-renowned Honorable Minister of Health and Coordinating Minister of Social Welfare, Dr. Mohammed Ali Pate, but importantly, his whole team, his Minister of State, his SSA, and the entire team that have shown such capacity and such capability over the last 2.5 years in particular, and have innovated so well and have delivered so much. And as the SSA said, their scorecard, when they look at the 9 or so items and pillars, they've cleared 8 of them comfortably, easily, and they are moving forward. But for Nigeria as a whole, under the able leadership of the President, as Honourable Minister of Budget said, we have to look at where we have come from and how far we have come and succeeded in turning things around for the better, removing distortions, stabilizing the economy, and in particular, delivering in important areas like the health sector, like other social sectors that mean so much to Nigerians. And the reality is that, and clearly, almost everything I'll say has been mentioned already. The fact that we have not yet, we're not yet in a position to declare victory, but we are on the right path, and what is required now is to sustain the effort. When we look at this whole of society approach, when we look at the fact that we are extending this compact from 2023's initial list of participants to now include civil society, traditional rulers, and so on and so forth, it's important, as was said earlier, that we mobilize our own domestic resources to the maximum, because we are in a world where multilateralism, communal, global effort has receded. We're in a world of bilateral relationships. But the one particular area where we can say that we are still, the world still recognizes that it has to come together and cooperate internationally is in the health sector and perhaps in terms of climate. So that, as was just mentioned, we are getting support internationally still in this important sector because we are providing the transparency, the accountability, and the governance that the world and other countries recognize that they can key into and support. And that's down to the fact that in this health sector today, in Nigeria, we do have excellence being demonstrated project by project across the whole sector. In addition, we must mobilize our own domestic resources. And, you know, I listened to Gavi. They talk about minding the gap. And by the way, I think those who know the story, Gavi's loss is Nigeria's gain in the form of Professor Mohammed Pate. But when we talk about the gap, when we talk about funding, we know that the health sector has turned around, and we know also that as funds have been made available, as the distortions in the economy have been removed, it has released funds which were previously not available to Nigerians as a whole. So those new funds, we've heard that under the federal structure, which has been carefully adhered to, federal has got more, yes, states have got more, local governments have got more. In terms of the federal, health has done well. The budget allocation, and I know there's a question of the gap, and I'll come to that, but the health sector budget in 2025, it rose by nearly 60%. And the BHCPF, our flagship, more than doubled from 31.5 billion in 2024 to 131 to 298 billion, nearly 299 billion in 2026. Similarly, with immunization, and I must say, and I must commit that we are actively seeking to raise additional funds, maybe around almost 150 billion naira, to cover vaccine procurement that is needed for 2025 and 2026. So we also know that the budget for health is well over 5%, I think 5.2% of the national budget, up from just over 3% a couple of years ago. So health is being prioritized. But it's important to answer that that's the appropriation. And of course, our challenge and our commitment is to close the gap between appropriation and release of funds. I'm sure you'll be comforted to hear that. Let me just round up, because we have heard so much, and we are also eagerly looking forward to hearing from our chief host and the very, very able leader of this whole effort in the health sector, this whole swap approach, sector-wide approach, that despite the federal level progress, we do recognize a growing fiscal dichotomy. States, as we have heard, and they admitted, have benefited from increased revenue, improved fiscal positions, yet spending on health and even education remains suboptimal. I think enough is said there. They will consider the fact that more has been given to them, and they need to do more in terms of this particular area of health. Honorable Minister Bagudu mentioned something that is critical. It's critical in terms of ensuring that even the gains so far of economic reform go right down. He talked about the world-based development program. That is taking resources, is taking capacity, is taking finance to each of the 8 1,809 wards in all the 174 local governments. And that includes helping people and supporting people and empowering people who are working in the health sector, who are working in areas that are revenue generating, that are productive. And it is, that is really the fulfillment of a whole of society approach where nobody is left behind, not just in giving them access to healthcare, but enabling them to help to grow the economy and even look after their own health and their own futures. So once again, I congratulate and I commend not just the Minister of Health and the Coordinating Minister of Social Welfare, but indeed his entire team, his entire ecosystem. And of course, I thank all of us who have come here to be part of this emerging success story in the health sector in particular and in Nigeria in general. Thank you and God bless.
Thank you so very much. Can we please again appreciate the Honorable Minister of Finance and Coordinating Minister of the Economy. Thank you. You can see that he spoke from his heart. As we track development in terms of health financing, sir, we have great hope that indeed the health sector will meet the needs of Nigerians. And on that premise, I'd like to invite my brother, whom I'm very, very proud of, the Honorable Minister of Health and Coordinating Minister of Social Welfare, Professor Muhammad Ali Pate, to address us.
Thank you, Antimoji. Yes. The Honorable Minister of Finance and Coordinating Minister of the Economy, my senior brother, the Honorable Minister of Budget and Economic Planning, my brother, the Minister of State for Health, the Permanent Secretary, our Royal Fathers, Special Advisor to Mr. President on Health, and also the Special Advisor on Public Health, our partners, Honorable Commissioners, other senior government officials, heads of agencies. Let me also stand on the existing protocol. I think a lot has been said by my dear brother in terms of why we're here, the road we've taken so far. I don't want to belabor that remarkable speech that he has already given. I will say that in the context of Nigeria's history, years and years from now when the story is written, in the decades to come, I have no doubt that the leadership of President Bola Ahmed Tinubu at this critical moment in our history will be one of the most glorious chapters in that history. I say that because of what we have seen in terms of the incredible vision he has laid down, but how it's translated. And from the two the coordinating minister and also my colleague, His Excellency, the Minister of Budget, you can see where this country is heading. I also want to acknowledge that the lieutenants that you have been to His Excellency, Mr. President, I think it's one of his greatest gifts in terms of chaperoning and leading this country through a very difficult time to where we are today. I want to most sincerely, on behalf of all of us in the health sector, the federal ministry, and my colleagues, even the states and our partners, to thank you for your steadfast leadership, because you have been with us. All that we have done, I think, was with your support on the direction of Mr. President. So thank you very much for being with us at this joint review. This year's theme, All Hands, One Mission, bringing Nigeria's health sector to light, captures both our collective aspiration and our shared responsibility. The All Hands, One Mission theme emphasizes our unity of purpose across all stakeholders: government, national, federal, states, local governments, partners, private sector, communities, civil society organizations, and our citizens, and the strengthening of our collaboration in that effort. In a mixed health system such as ours, the government alone cannot meet all the health needs of its citizens by itself. Achieving the aspiration that we have demands a whole of government, whole of society approach, one that harnesses the strengths of the private sector, the capabilities of our development partners, the vibrancy of our civil society, the blessings and support of our traditional and religious institutions, and the active participation of our citizens. The fact that we have His Royal Highness, His Eminence the Sultan, and the President of Cannes with us here is a testament to that unity of purpose that has been manifested. And bringing the Nigerian health sector to light underscores the fact that transparency, accountability will help ensure that we make the progress and be able to tell that story of our progress in a measurable way. It also challenges us to hold ourselves to the highest standards and to welcome the scrutiny of all those we serve. This year's JAR builds on the baseline that we set last year and serves as a crucial accountability tool that allows us to track this progress, identify the gaps, and chart a unified course towards better health outcomes for every Nigerian. It will assess health sector performance on key indicators that we had agreed and feature the signing of an updated compact with an addendum to include local government areas, private sectors, traditional religious leaders, and the CSOs. As a result, the compact, which was originally signed in the presence of His Excellency Mr. President, will now be better positioned to further drive our progress towards universal health coverage. Now the good news, because I think there is a lot of good news. And I will ask that we all listen carefully to this good news that will be broken down into details and interrogated during this annual review. You recall the commitments that we had in the original compact on things that have to do with governance, accountability, service coverage, and the citizens' perception of the Nigerian health system. First, on the alignment with the HSRI swap commitments under the swap. 84% of our key performance indicators under the presidential bond commitments have been achieved as of Q3 2025. That is 37 out of 41. And 35 states out of 36 plus 1 state, that's 6 states plus FCT, have now conducted their state joint annual reviews and state performance dialogues with active citizen participation in sector decision-making at all levels. This morning, I saw the governor of Jigawa in office at 1 a.m. during the Jigawa State Health Sector Review. I got the picture early this morning because they had to do theirs. That's an example of how the states have also keyed in fulfillment of the compact that we signed. All the 36 states and FCT have their annual operational plans that are fully aligned with the health sector strategic blueprint and the priorities indicated therein. 72% of states have established functional non-communicable disease coordination mechanisms to deal with hypertension, diabetes, and other non-communicable diseases. All local government areas in the country, 774, have the National Health Fellows, plus the PFMOs. So we've exceeded that target tremendously. And all the ministerial oversight meetings that are supposed to have been held, and 60% of the National Council on Health resolutions have been implemented. This is the historical resolutions. These results show that the compact commitments were not just words on paper. They are being translated into tangible actions at national and state, at federal and state levels. Nigeria is steadily shifting from a fragmented, donor-led programming to more coordinated, more coherent, nationally owned systems driven by the need to achieve results. On service coverage, across the reproductive, maternal, newborn, and child health and primary healthcare indicators, the data that we have shows consistent progress and expansion of service utilization in 2025. There are so many of those data points that I will not bore you. But across 2025, and according to the quality adjusted DHIS2 data, the percentage of deliveries attended by skilled birth attendants is now more than 90%. Given where we were, I think that's a remarkable improvement. And routine HMIS data indicate that ANC4, the fourth antenatal care coverage, was 39% in 2023, while the corresponding survey was 52%. For 2024 and 25, the coverage levels exceed 50% in both years. So we've seen a bump in terms of women attending antenatal clinic. New family planning acceptors have increased steadily every quarter, with an overall 10% increase from Q1 2025 to Q3 2025. This is a promising trend for crashing maternal mortality. Half of women of reproductive health age were using modern contraception, which is very good because it's meeting the unmet needs of our women, respecting the rights, respecting the tradition, the culture, and the values, and the rights of each family to decide what is good for itself. And routine data has shown modest improvements in vaccination coverage for specific antigens. Thanks to Gavi and for the amazing support, I think we've hit most of our target for measles and rubella in addition to HPV, which is now a beacon of hope, I think, on the immunization stage globally. And the primary healthcare utilization in BHCPF facilities grew from 10 million visits in Q1 2024 to 37 million visits in Q1 2025 and to 45 million visits in Q2 2025, showing renewed public confidence in accessing primary health services. This is remarkable. It shows that the work that is being done, led by this government, I think is beginning to show results by people showing up for services. In terms of outcomes, the maternal outcomes, with baseline of 2023, maternal deaths, and I hope that we will listen carefully to this, has declined by 17%, and newborn deaths by 12% across the 172 local government areas that we targeted. These were the MAMI local government areas that we targeted because they accounted for more than half the maternal deaths in Nigeria, because maternal death is not distributed equally across all local government. Using good data, we identified those and we focused on those local governments, and we're already beginning to see 17% reduction in maternal deaths and 12% reduction in newborn deaths. And we will have many DHS in 2026 to have population data to confirm if this change in trajectory is actually continuing and to be deepened. But it's good validation that we are making good progress. 52% of those 172 local governments have now at least 2 level 2 primary healthcare facilities. And 435 facilities have been revitalized in those 172 local government areas. More than 15,000 community-based health workers have been recruited across priority states, and we've retrained almost 70,000 frontline health workers, as we had promised on our path to 120,000 by 2027. The skilled birth attendance coverage has increased by 33%, and for the local governments, 4,000 free cesarean sections have been conducted in the NHI empaneled facilities. This is, if you recall, at the last year we announced to cover emergency obstetric services, including cesarean section, which is the barrier to many women accessing the critical services to save their lives. So that is beginning to show promise in a systematic way. I think we are making progress. There are so many more data points, but I will leave it to the technical discussions that we can drill down. The DHIS is hosted by our Planning, Research and Statistics. You have the statistics book. We can interrogate, we can debate confidence intervals, sampling, institutional, whatever it is that we want to. But at least we've moved from faith-based policies and programs to more evidence-based policies and programming. And in response to our citizens' perceptions, consistent with the President's direction that our focus should be to respond to the needs of Nigerians. We are fortunate that when his administration started, we had a People's Voices survey to ask citizens, what is their experience? What is their expectations? We had that in 2023. We had that in 2024, the same tool, survey administered to thousands of Nigerians. And thankfully, 2025, we also have a citizen's perception, which in a way checks the opinions that may be dispensed by pundits that may be sitting in Abuja. I think it's easy to form opinions, but if we have good data, you can debate whether the sample is big enough, whether it's biased, but at least it speaks to the issue more credibly. And for those who may be very uncomfortable when they see President Bola Ahmed Tinubu succeeding, I'm sure they will just be more uncomfortable when they hear what Nigerians are saying about the health sector that he is leading. The confidence that Nigerians have that the government considers their own opinion in decision-making is almost to half of our population. The endorsement of the trajectory of the health system has also increased to 55%. The confidence in the government's capacity to manage health emergencies is now at 67%. And other indicators that are linked or related to patient satisfaction and user experience of care and service utilization have remained at a high level since 2024. Patient satisfaction with healthcare facilities and primary healthcare services, at least from the survey, remains high at 74%. And this is still a good score given the tremendous challenges that we know exist. Despite this, we know that the overall sense of positivity, almost 2/3 of Nigerians believe that there is still more work to be done, and that is very much noted. The issue of affordability also came out very clearly, that access is improving, but we have to do more in terms of enhancing affordability of health services. And thanks to the ministers here, we do have plans, I know, for the medical relief program and other ways to improve the affordability of healthcare services. But I think Nigerians can be rest assured that this government is very keen to take measures to improve the affordability of healthcare services, among other important public services for Nigerians. Expanding health insurance beyond the 12% that it is now to higher numbers is still our goal. I think 2 years ago it was hovering around 6 to 7%. Now we are getting to 12%. The mandatory health insurance has been circularized. So Nigeria is steadily making progress in terms of expanding that alongside the vulnerable groups fund that we have. So all these results clearly demonstrate that the important processes that we have put in place to reduce fragmentation, to improve coordination, to enhance country ownership and other key SWOP principles are now yielding tangible results. The data reflect real progress, but also remind us that there is an unfinished work. And I thank the National Assembly members who are here, the Senate and the House of Representatives, because they have been steady partners with us along the way in the oversight, in providing the appropriation, and we will count on them that the appropriations and the commitments that we have made and the execution is beginning to show results. So the unfinished work is something that we will have to focus on. We must consolidate the gains, sustain the financing, and continue to expand health insurance coverage, especially for the poor and vulnerable. Above all, we must continue to strengthen the primary healthcare system itself, which remains the bedrock of our journey towards UHC. Our goal is clear: universal healthcare for every Nigerian, regardless of location or income. To achieve this, we must advance the localization agenda of the health sector, ultimately reducing our dependency on external assistance, focusing on our sovereignty, and building resilience through domestic resource mobilization and local manufacturing of medicines, vaccines, and commodities, as well as other health technologies. Building our supply chains to make them strong. This also means increasing not only what the Honorable Minister of Finance has committed and the Minister of Budget, but state governments to invest in health, in education, in water, in sanitation, in areas that will improve nutrition. The multi-sectoral effort is so critical, and to deepen the President's direction in terms of the ward-based development approach, which is the most progressive approach that we can take to lift Nigeria from where it is to where it can be. I believe that if state governments and local governments who are with us now will all focus on that, Nigeria will be in a much better place. We'll continue to work on exploring sustainable and innovative financing options, such as innovative use of fiscal measures like taxes for sugar-sweetened beverages, public-private partnerships, and using digital solutions to enhance transparency and accountability. It also means expanding and deepening the work and investments in the health workforce so that we can produce more, train them well, those that are in service, motivating them and retaining especially the frontline health workers. In the last 1 year alone, more than 20,000 frontline health workers have been recruited to federal tertiary hospitals, filling important gaps that existed. This is within the budget that was available to those facilities by removing the barrier, the delay in terms of getting those waivers. We are not there yet. There are significant legacy issues in terms of the human resource agenda for our country, some of which have dated for 10, 20 years. In the last few months alone, I think the Honourable Minister has approved more than 50 billion to settle outstanding arrears, to settle needs for various parts of our health professionals. We're engaging in a constructive manner with leaders in the health professions to ensure long-standing issues of compensation allowances are reviewed in a way that meets the needs of the health workers in a responsible way. Our call to all Nigerian health workers is to put the Nigerian person at the center of our attention. If we do that, all issues are resolvable. And I would like to encourage all of us as leaders across levels to continue to pursue that. Let me thank all of you for joining us and applying ourselves to have a successful joint annual review. And once again, thank my colleagues in the Federal Executive Council, especially the ministers that are here, for your support, and all our other partners, members of the National Assembly, especially the state governments and the commissioners that are here in full force, and local government areas, civil society, private sector, who have come from far and near to join us in these deliberations. Thank you very much. Thank you.
That's it. The Honorable Minister of Health and Social Welfare, the Coordinating Minister, Professor Mohammed Ali Pate, giving a scorecard of the health sector. Very impressive, and I'm sure the nation has listened and will be tracking the development as we continue. Another very resounding round of applause. He has been very emphatic that we cannot get it done in Abuja. It has to cascade to the states and local government. And that's why the health sector is very emphatic on inclusive governance. And it is in this regard that I'd like to invite the next speaker, who is representing what the state can do or what the state should do, representing the Governors Forum. Today we have with us Professor Olalikon, who is coming to speak on behalf of the governors. He is very strategic to what he's going to say, because he's the Executive Director, Strategy, Research, and representing the Nigerian Governors Forum. Please, let's welcome him warmly.
Your Excellencies, distinguished ladies and gentlemen, permit me to stand on existing protocol for want of time. I'm actually here to read the keynote address of the chairman of Nigeria Governors Forum, His Excellency Abdurrahman Abdurazak, who is also the executive governor of Kwara State, who ordinarily will have been here personally, but for some other exigencies of his office. It gives me great pleasure to address you today on the second joint annual review of the health sector, which is being organized by the Federal Ministry of Health under the leadership of my dear brother, Professor Mohammed Ali Pate, the Coordinating Minister of Health and Social Welfare. Let me begin by commending the Honorable Minister for his continued visionary leadership, resourcefulness, and spirit of partnership. Last year's gathering set a strong tone to transparency that now defines our health sector. The Ministry of Health has continued to model a spirit of partnership that places states at the heart of implementation. The rollout of support to states under the sector-wide approach and the Basic Healthcare Provision Fund has been a game changer. The third round of 32.9 billion naira disbursed recently for primary healthcare delivery, along with bundled swap packages to states, represent a major milestone in our collective journey towards effective financing and predictable implementation. For the first time, states are clear on the support getting to them from the federal government, and this will help inform annual operation plans and shape delivery. This is what planning discipline and true fiscal federalism looks like in practice. Already, we are seeing signs of progress. The Performance Dialogue held mid-year brought federal and state teams together to harmonize plans and targets under the health sector strategic blueprint. We are also encouraged by programs such as the National Health Fellowship, which is helping deploy young professionals to local government areas to strengthen service delivery and community engagement. These efforts speaks to a system that is becoming more aligned, data-driven, and results-oriented. This year's theme, All Hands, One Mission, brings the Nigerian health system to light and could not be more fitting. It captures the very essence of what this joint annual review represents, a unified mission shared by all levels of government, development partners, and communities to make our health system feasible, functional, and accountable to every Nigerian. Bringing the health system to light means shining a spotlight on performance, data, and results. It means transparency in how funds are used, evidence in how policies work, and equity in how citizens benefit. At the Nigerian Governors Forum, beg your pardon, we continue to uphold this spirit of shared accountability. Our scorecards and peer review platforms enable us to track state progress on governance, financing, service delivery, and data use. These tools fosters healthy competition, learning, and transparency, ensuring that commitments are not only made, but measured. The NGF Secretariat continues to provide the evidence base that helps governors make better decisions and reinforces our joint accountability to the citizens we serve. We also acknowledge the remarkable momentum around the maternal and newborn mortality reduction innovation initiative. It is bringing federal and state governments together with communities to ensure that no woman dies while giving life. This is the kind of investment in people that defines true health sector reform. As we deliberate today, let us remember that every conversation here must translate into action. Our mission is not abstract. It is about saving lives, restoring trust, and delivering hope. It is about the mother who survives childbirth because a health facility hard power and equipment when she needs it. The child who receives timely care because referral systems worked, and the health worker who feels valued because systems now respond to their needs. This second joint annual review reminds us that the path to universal health coverage is a collective journey. It requires all hands, federal, state, local, partners and communities working with one mission to bring Nigeria health system fully to light through accountability, coordination, and investment in the people who make it work. Once again, I congratulate the Honorable Minister and his team for sustaining this reform momentum and fostering collaboration across all tiers of government. On behalf of the Nigeria Governors Forum, I reaffirm our commitment to this mission and to the continued partnership that drives it. Together, we will ensure that our health system truly works for every Nigerian. Thank you, and may God bless the Federal Republic of Nigeria.
Thank you very much, Prof. Speaking on behalf of the Nigeria Governors Forum. Now, about 2 years plus, we witnessed the first signing of the health sector renewed UHC compact by governors from the 36 states of the country, but in furtherance of ensuring that this agreement works and is working for the benefits of Nigerians, there is an addendum, and that's what we're going to witness in the next couple of minutes while I invite the Honorable Minister of Health and the Coordinating Minister of Social Welfare to lead his colleagues as he would lead on the signatories to this side of the hall. The Honorable Minister of State for Health and Social Welfare will be leading all the witnesses. I'd like to quickly call out the ceremonial signing of this addendum to include representatives of ALGON, very important, the private sector, traditional and religious institutions, and expanded focus areas. Like the CSOs, the SCO, WHO, Chairman of the Commission of the Honorable Commissioners, the World Bank, Gates Foundation, and of course Gavi. Is a conglomerate of people that will make it work. We'll now call on the signatories who will be signing. We'll start with the Healthcare Federation of Nigeria. Healthcare Federation of Nigeria. Then, of course, the Health Sector Reform Coalition, the signing on behalf of Nigerian Voices. Hello. Also, President of CAN, the traditional institution, Emir of Shonga, His Royal Highness, Association of Local Government of Nigeria, ALGON, The Nigerian Governors Forum is also going to be a signatory. And of course, the ministers present would also be signatories. Minister of Budget and Economic Planning, the Minister of Finance and Coordinating Minister of the Economy, as well as the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. Health Development Group, please. Dr. Mary, please, can you join? Thank you. Health Development Group. Let's welcome the Health Development Group partners.